Members of Generation X, those born between the mid-60s and early 80s, are experiencing a generational crunch as aging baby boomer parents require more care and attention from children who are raising children of their own. They are part of the sandwich generation. You're listening to Engage on Central Florida Public Media. I'm Sharon Stone. As part of our Engage in the Community initiative, we assembled a panel of professional caregivers, elderly care organizations, and caregivers with personal experience assisting their parents while juggling their own families. Today, we are presenting that discussion called Caring Across Generations. This was held Thursday, August 21st at our Central Florida Public Media studios on East Colonial Drive. Caregivers are stepping into a role that's probably asking a lot more of us than we ever expected. You're trying to figure out what to do when everything you thought you knew and your entire family dynamic just changes. It's learning how to balance that strength with compassion, and you're sitting in this moment, at the same moment you feel love and grief, and how do you navigate it all? Maybe you have lived it, maybe you're in the thick of it right now, or maybe you're expecting it. Caregiving touches almost all of us, and it is emotional, it is rewarding, it is exhausting. And in many cases, it's all-consuming. The work you're doing is often invisible, but not here and not tonight. We are pulling back the curtain on what it is like to care for people that we love, whether it's our kids, our partners, our parents, sometimes all at once. And this is becoming more common here. Florida is outpacing the national average of people expected to become caregivers in the next 2 years. Pew Research shows Florida has one of the highest percentage of people in the sandwich generation taking care of children and older relatives at the same time. Our panelists bring unique experience and perspective to the complexity of intergenerational caregiving. I'll just go down the line. Maritza Vasquez is raising her grandchildren, 2 of which just graduated from high school. Congratulations on that. And taking care of your 93-year-old father, working with and for the Children's Home Network, and known to friends as the resource queen for caregivers.
Yes.
Next to her, we have Erin Branton. She stepped in the role of caregiver at the age of 22. Her father was diagnosed with traumatic brain injury-induced dementia after a car accident. Lindsay Taylor is the program manager at the Alzheimer's Association, supporting caregivers navigating the realities of dementia. Christy Eastman is founder of Renewing Hope Care Management, a nurse care manager and former caregiver to both her parents. She helps adult children step out of constant crisis mode and just be a son or daughter again. And last but not least, after losing her mother to breast cancer, Shariga Ofori found her calling in person-centered care. She is CEO of Kinbridge at Oviedo, which is a new intergenerational assisted living facility, and the mother to a 21-year-old and a 3-year-old. So thank you all for being here. I want to talk to you about what caregiving really feels like. But before we get to that, I would just love to go down the line. If I could ask each of you to describe the caregiving experience in a word, what would it be? I'll start with you, Maritza.
Redesign, reconstructing
Redesign?
the own self.
Karen?
I would say humbling.
I'd say honoring.
I'd say roller coaster.
Wow, you guys took all my words.
I would say,
I don't know. I would second rewarding.
Rewarding?
Mm-hmm.
It is a mix of emotions, and I appreciate all of you exploring them tonight. Erin, most people couldn't even fathom becoming a caregiver in their early 20s.
Right.
That's where you were after your father's accident.
Yeah.
What was that transition like for you?
So a little bit of backstory. It happened in 2019. So throughout 2019 and into 2020 was when his decline really started happening. And in 2020, we all know that we went into quarantine. And something that I realized in that moment was quarantine, when we all went into it because of COVID, I was already experiencing because it felt so isolating. especially in the beginning, because my parents had me when they were a little bit older. My mom was 40 when she had me. And so none of my friends were experiencing or walking through the same thing that I was walking through. And it's not something that got better, and it was supposed to, right? And then he had the dementia and now it's an Alzheimer's diagnosis. But really learning on how to like sign up for that for the long haul
Yeah.
was really important to me.
And you also mentioned to me it's shifted for you. So where are you now with it?
Yeah, so it's been a huge shift in my perspective. At first, I was obviously angry. I didn't want to be signing all these papers that if something were to happen to my mom, that I was in charge and like learning about important documents. Like I was just a senior in college. I didn't know what I was doing, and like being thrust into like the caregiving role was something I did not expect. And so I was angry, and seeing my dad and how frustrated he was and embarrassed as how he declined, I really felt like it was an honor and it was rewarding being able to care for someone who cared for me so well. And at the end of the day, like I shared with you too, like he's just my dad.
Yeah.
And so despite, his brain injury and all of that, like at the end of the day, he's still my dad.
Right. So you told me that you kind of went into this survivor mode. This isn't where you expected to be at this point in your life, caring your father, caring for grandchildren. Where did you expect to be now? And what keeps you going?
What keeps me going is to strive for others, other caregivers, and the children that I serve, the father that I serve. That's what keeps me going. There's a huge number of grandchildren that grandparents, that caregivers as grandparents are serving, which is right here in our local county, our local Orlando. It's over 15,000. And then you have over 100,000 statewide grandchildren, grandparents taking care of the grandchildren. And we're the third largest population of grandparents taking care of relative, non-relative children.
Yeah, you're speaking for a huge population.
That's huge.
Sharika, you balance being a parent and taking care of your parent. As much as you're comfortable sharing with us, talk to us about how the experience of losing your mother just changed your view of what caregiving looks like.
I was 22, 23. Just graduated from the University of Central Florida. My mother was 44 when she was diagnosed with breast cancer, went into remission, and it came back at 47. When it came back with a vengeance. So it was very difficult at a young age. And at the time, I was not a nurse. I'm currently a registered nurse, but had no background in healthcare to be able taking her to doctor's appointments. And I remember in her doctor's appointments with the oncologist telling us and trying to educate us, and we didn't understand it. And it was very difficult because I had to resign from my job to take care of her. And fortunately, I was in a position, my father was in a position to be able to take care of us financially. However, that's not always the case for everyone, right? Um, but being able to navigate in the healthcare system, we felt lost. A lot of times when, we had to follow up and take the medications and the side effects and the emotional and mental toll, there was not a lot of resources to help us through that process to navigate the healthcare system. Um, and just knowing and understanding is just half the battle, right? And that's when I decided, after my mom passed away, that's when I decided I wanted to become a nurse to help bridge the gap of understanding because there were so many things that we missed that we could have taken advantage of if someone just took the time to really break it down and being able to get on our level of understanding to educate us on what the cancer markers mean, what the medication side effects can do, and how you can navigate and be able to subside those side effects, right? And dealing with the mental health part of it and the psychiatric part of it, it's a toll. It is a toll. It's a heavy toll to put on a 20-year-old, to put on any family, right? And that's what Kinbridge is about. being able to bridge that gap. I think we have to do a better job as healthcare providers to educate our community from the hospital to home, and making sure that they are educated and know. And sometimes you have to slow down as healthcare professionals, because for us now, looking back at it, now what I know, you rush through it, and I don't know if anyone has had this experience, and you're just spinning 1,000 miles and trying to put the pieces together. Okay, you have the pharmacy, and then you have the primary care physician, then you have the specialist, and then you have this, and then you have labs, and then you have this, and all of it intertwined together. We just need good advocates to bridge the gap in the middle, to be able to help the community understand how to navigate and how to be able to take that home and process it.
So, Lindsay, in preparing for this panel, you told me about something that just I'm still having a hard time wrapping my head around. A study showed that 20% of spousal caregivers of people with Alzheimer's or related dementias died before the person they're caring for. That is 1 out of 5. And other studies showed the numbers even higher. Why?
Well, unfortunately, that is true. I think it's about, depending on the study, 18% or a little higher of spousal caregivers. And then in general, caregivers have about a 63% higher mortality rate than the average population due to the stress and the neglect of their own health and things of that nature. And I've seen that in my own family. So I work for the Alzheimer's Association because I've had 3 grandparents with Alzheimer's or dementia. So I've seen firsthand the sometimes devastating impact it can have not only on the person that has it, but probably more so their family members, their friends, and their caregivers. And I had an aunt who was caregiving for my grandmother and ended up having to have open heart surgery during that process. And I had a father who was caring for his 2 elderly parents, one with dementia, driving back and forth across states every other week to take care of them, neglected his own health symptoms, and passed away from cancer without even knowing he had had cancer because he was neglecting to notice those symptoms in himself. So I think it has to do with the immense amounts of stress that caregivers are under and the lack of time that they sometimes have to put into themselves, into their own health.
Are there signs to look out for as a caregiver where you can identify this is getting to the point of dangerous or perhaps life ending for me as a caregiver?
Well, if you're a caregiver and you haven't yourself been to your own doctor's appointment within the past year, I would say that that's kind of a sign. If you are noticing yourself be at the complete end of your rope more often, like really snappy, you're not getting any sleep at night, those could be those warning signs that you really might starting to be burning out on the caregiver job, which is very, very common. It's not possible for any one person to take care of someone 24/7.
And Maritza, you told me you were exhausted basically becoming a parent again, and you realized the importance of prioritizing self-care from another caregiver. Would you share what you learned?
Yes. In the beginning, 10 years ago, actually, 2015, when I was just a witness in a courtroom and being that advocate for my grandchildren. And then I had 2 additional children, so it was 4. And seeing the other grandparent, she didn't want to care for the children. And I didn't know, I was in college. I'm like, well, what's going to happen to them? Oh, they're going in the system. And I'm like, oh, okay.
Mhm.
So I took in 4. And it was lovely in the beginning. They say case management is going to help you and blah, blah. And that's completely not what it was. It was survival mode, like I said, for me. And if they had a manual in the beginning, from the beginning, that would assist us. It was really stressful.
Yeah.
But thank goodness that during that time, Children's Home Network kinship came, and it was just like an aha, a safe haven, and a community of other grandparents or just relative, non-relative, that support system and exchanging numbers and having a babysitting type of quell because there's no respite. But turned my life around.
Yeah.
We're missing that here right now in Central Florida.
Let me follow up with something. It was a comment I read on one of our boards in the back. Someone wrote, I don't have the time to cultivate the relationships and support networks. I need to be there to catch me. So I'd love to ask you panelists. We can say all day, you've got to prioritize self-care. I would love to operate in reality. What can you do to really practice self-care given the constraints of reality? If anyone has any advice.
Therapy.
Therapy?
Therapy. Yes.
Okay. On my side, these are going to sound maybe a little silly at first, but really we might only have 5 extra minutes in our day when we're really in the throes of caregiving, right? So it could be if you're up first, those first couple sips of coffee, don't ignore that moment. Actually sit there and notice I'm having this quiet moment to myself, and this is a nice sip of coffee. If in the middle of the day you need to go into the bathroom and lock the door, as long as your loved one is safe, that's totally okay. Go get a few minutes to yourself. I mean, my mom told me when I was born, I never stopped crying, and she would just go sit outside in the driveway because she was afraid she was going to like shaken baby syndrome me. So yeah, just get any type of escape you can allow for yourself as long as your loved one's safe. Go scream into a pillow. It doesn't need to look like this ideal image of self-care, like you're going to get your nails and your hair done. Yeah, you might not have time for that, but you can probably make time to go take a 10-minute shower.
Sharika and Christy, I noticed you both were kind of nodding along in agreement. Any other advice from either of you?
I agree. I think that sometimes we think about a self care as something that has to be an hour or a vacation or something like that. But I think it's important to really focus on moments in the day. And that could be 5 minutes, that could be 15 minutes, that could be 30 minutes, but take advantage of those. Sometimes it's just taking a moment to breathe. Sometimes we forget to take a deep breath. And I think taking advantage of the moments that you have. I know I have a tight schedule, but I try to take, I've learned to take those moments of sometimes just listening to a song I like or just breathing or looking at a funny video. That may take me 5 minutes, but it helps to recharge me. And so I think things like that are important. I agree. I think the biggest thing that everyone has described is release. You have to let go and release and find an outlet to relieve the stress, to relieve the anxiety, whatever that may be. It might be crying one day.
Yeah.
It might be, yelling and cursing, whatever that looks like for you in that moment, and really appreciating the 5-10 minutes that you can get just to yourself. And I'm speaking from experience with a new 3-year-old. But yeah, just those 5 minutes. And I think, just appreciating the little things.
We'll have more from our Engage in the Community discussion, Caring Across Generations, addressing the pressures of caring for both aging parents and raising children. And we'd like to keep this conversation going. We encourage you to share your stories and experiences assisting both parents and children. You can connect with Engage by sending us an email to engage@cfpublic.org, or you can send us a talkback on the free Central Florida Public Media app. In the menu, select Send Us a Talkback, record your question or comment, then hit send. This is Engage on Central Florida Public Media.
The Wrap is a podcast from Central Florida Public Media, curating the top Central Florida news stories and in-depth reporting each week. Join me, Brendan Byrne, as I bring you news headlines, deep reporting dives, and insightful conversations from the news team. A new episode of The Wrap every Friday morning. Get it wherever you get your podcasts.
You're listening to Engage on Central Florida Public Media. I'm Sharon Stone. State Republicans have considered following the lead of Texas in redrawing congressional districts ahead of the 2026 midterm elections. Republican leadership argue it is necessary given the dramatic population shifts in recent years. Democrats say it's a desperate ploy to retain power in the face of unpopular policies. Next week on Engage, we'll look at the efforts to redraw Florida's congressional districts 5 years ahead of the redistricting schedule. We'd like to hear your feelings about the state's redistricting proposal. You can send an email to engage@cfpublic.org. We'd really like to hear your voice. Send a talkback on the free Central Florida Public Media app. In the menu, select Send Us a Talkback, record your question or feedback, and just hit send. Back to our discussion on intergenerational caregiving now. We've returned to our panel discussion addressing the needs of Florida's growing sandwich generation, those caring for both aging parents and growing children. The conversation is part of Central Florida Public Media's Engage in the Community series, bringing communities together through the conversations around shared experiences. This discussion, titled Caring Across Generations, was conducted this past Thursday, and the panelists included Shariga Ofori, CEO of Kinbridge at Oviedo, Lindsay Taylor, Program Manager at the Alzheimer's Association, Christy Eastman of Renewing Hope Care Management, Erin Brenton, a Central Florida resident who has been caring for her father since she was 22, and Maritza Vasquez, a former emotional support specialist with the Children's Home Network, who has been caring for both her 93-year-old father and her grandchildren.
Does anyone have any thoughts on what to say to someone who is just doing the best they can, but they just feel like it's not good enough and they're failing their loved ones?
I'd like to share. I
Please.
think that when people start to feel that way,
Yeah.
they're probably burnt out. When they start thinking that they're not doing enough, usually they are probably at their max. And I would say that you are doing enough and probably doing more. You're probably overgiving. You're probably saying a lot of yeses when you should say no. And so I would say that you are doing enough. And I think that it's important to learn how to make space for yourself and set boundaries even while you're being a caregiver. And I know that's easier said than done. But I learned that because I took care of both of my parents and I was burnt out many times because the journey was not over like 1 year or 6 months. It was over like 20 years. So, and I think a lot of people have that experience. You're caring for years. And so I think that when you get to that point where you feel like I'm failing, I'm not doing enough, you're probably just burnt out and you need to find support and find ways to care for yourself.
Lindsay, can you think of any resources maybe we overlook when it comes to that burnout?
Yeah. And before I say that, I also think as humans, our brains are wired negatively because it just makes sense. It's made that way to keep us alive in dangerous situations. But because our brains are wired negatively, we're focusing on the negative more. Mom's mad, or I didn't do XYZ. I didn't get to these chores today. If we can shift our mindset to the things we did do, look how I'm taking care of mom when the rest of the siblings haven't called for 3 weeks.
Yeah. So you hear.
Right. Yeah. Yeah, exactly. But yeah, trying to shift your mindset just a little more positive and reminding the family and friends and neighbors and whoever else in your community that are caregiving. I'm really grateful that you're there for your mom. Thank you for being such a good sister. Just those little thank yous can really support a person. But resource-wise, things people might be forgetting about are caregiver support groups where you can go and sit for a little bit or even join on the phone or on Zoom if you can't leave your loved one alone, just to share how it's like for you and learn that you're not alone, because caregiving can feel quite isolating. But look how many people are going through it. So many people are experiencing very similar things. So a caregiver support group can be a great outlet. Specifically, if you are looking for a dementia support group, the Alzheimer's Association has many of those available, and you can access them by calling our 24/7 helpline. That number is 800-272-3900. But additionally, there's respite care resources to give you a little bit of a break, whether that's you hire someone to come into the home and sit with your loved ones so you can even just go sit outside. Bring a grandchild over and they can sit with their grandparent if it's safe. Well, again, you go sit or walk outside for a little bit. Or there's adult daycare programs. There are facilities where you can even pay to have your loved one stay there for a couple of days if you're really reaching the end of your rope and need that break, or say you need to travel to a funeral or whatever else. There's respite care resources available as well.
And Cambridge does offer respite care. So, yeah, I was going to to that as well too. And if you guys have, your Medicare, Medicaid, health insurance, and or also your life insurance policy, a lot of times you might have a long-term care rider that can pay for those services. And there are pilot programs as well too that will help pay for the respite care services.
Sharika, I want to make sure everyone knows what you've created with Kinbridge Care at Oviedo. This is a multi-generational care facility. What inspired you to create this intergenerational living space? What was missing?
What's missing is the services for our seniors and our young adults. So, an assisted living facility is for individuals 18 and older. A lot of times when people think of assisted living, they think of seniors, right? But there are many young adults with special needs that face the same challenges as our seniors: isolation, depression, loneliness. And so at Cambridge, we open our doors to 18 and older to have a home to live in and be able to have a family within the facility, being able to bridge that gap between generations. So we take care of people at 102 and 22, but it makes a really great concept because a lot of the older adults, they're so nurturing, men and women. When they regress into their Alzheimer's or dementia, they regress back and they think that the young adults are their children. So they are nurturing of them. They teach and they care for them. And then on the flip side, the young adults, like the older adults, they take care of them because they look at them as they need help, they need assistance, to walk or their walker, or they'll grab something for them and help them with their breakfast or lunch. So it makes for a very tight knit community and family to have all age groups under one roof.
Yeah. I'm thinking about just navigating these different generations. And as much as we like to think in crisis, family's going to come together, we're all going to figure it out. Again, it's just not always the case. Sometimes crisis can bring cracks to the surface. Christy, you've worked with a lot of families and you lived it with your siblings. What can be done when this caregiving gets entangled with family dynamics?
Yeah, it could be challenging at times because everybody has different family dynamics. And part of my job sometimes is as a care manager is facilitating family dynamics and helping them navigate through different experiences. Recently, I had a client that had 3 children, and one person didn't want to be involved. There was only one person that was doing the main caregiving and one family member that was not local. But the person that was doing most of the caregiving and in the home had a lot of outside opinions from their siblings who were not doing the actual work. So it's very difficult. And the children that were not in the home doing the caregiving, they thought they knew best. And so I got involved because I could be a professional and unbiased opinion about what's going on and what mom needs. And so I think sometimes it's involved to get sometimes professionals involved, like care managers like myself, to come in, do an evaluation, and really understand what's going on, and then giving that information to everybody so that everybody understands what's really going on and what the needs are. And then help the family navigate how can they work together. And sometimes that's not possible. I've seen that where sometimes the dynamics of that it's not possible, but you try to make the best of the situation and really help them navigate with how they can best care for their loved one.
Erin, you mentioned to me that for you it's an honor to take care of your father. How do you navigate this new role that you're in and also your mother as well?
Yeah, so when my dad's accident happened, I was still living at home. I got laid off from my job in 2020 during COVID. And I was in grad school at the time, and I just didn't find another job because I was full on not wanting my mom to have that whole responsibility. So, as much as like my mom was my dad's partner, right? As the daughter, I felt this very interesting role in helping my mom and keeping her mental health and keeping her, sane while also caring for my dad. And then when they would get in fights, or my mom would try to get my dad to do something and he wouldn't listen, and then I would have to come in like a different way. So that was a really interesting piece to navigate, as well as when I wanted to move out. My dad was actually still at home, and my mom wanted that for me to leave. She didn't want to be a burden. And I never want my parents to feel like they were ever a burden to me, but she wanted me to live my life because she saw how different my life was versus the other people my age. And one thing that I thought that I had failed, which I want to bring up with a little bit what we were talking about earlier, is my dad now lives in a memory care facility. And when my mom called me the day that she wanted to put him in a memory care facility, I felt like we as caregivers, as a team, had failed. And I feel like that is a very important topic to talk about because we're all here talking about resources, right? And why did I feel so ashamed to reach out for that resource? I had moved out, I was starting my career. My mom was waking up at all hours of the night with my dad walking down the street, and we had a pool in the backyard, and she was so scared that he could get out and get in the pool. And so it was really difficult because I didn't want that. I didn't think we were there yet for that route. But the more I talked to my mom, and I wanted to be a support for her as well, I saw that we were there and we needed to reach out for that support.
We'll conclude our panel discussion, Caring Across Generations, when we return. This is Central Florida Public Media. You are listening to Engage.
There's a lot going on in space, from efforts to land astronauts on the moon
and liftoff of Artemis 1
to answering the age-old question, are we alone in the universe?
Wouldn't you want to know if there was life on another planet?
Are We There Yet? Explores space exploration every Tuesday at 6:30 here on Central Florida Public Media.
You're listening to Engage on Central Florida Public Media. I'm Sharon Stone. Last Thursday, we held a panel discussion as part of our Central Florida Public Media's Engage in the Community series. The topic was the conundrum caregivers face finding themselves caring for aging parents and their own children. The panel included Shariga Ofori, CEO of Kinbridge at Oviedo, Lindsay Taylor, Program Manager at the Alzheimer's Association, Christy Eishman of Renewing Hope Care Management, Erin Branton, a Central Florida resident who had been caring for her father since she was 22, and Maritza Vasquez, a former emotional support specialist with the Children's Home Network, who's been caring for both her 93-year-old father and her grandchildren.
As I'm listening to all of you speak and share and open up, I'm wondering, we're talking about resources and how hard it is. What do you think the problem is that we're trying to solve here? Do we need to completely rebuild the system? Like, what should this system look like?
So I think that's a very loaded question. I can take it from one perspective, right? I had a family come and tour yesterday, and it was a daughter who's an accountant, and her mom is currently at a skilled nursing facility, and they're telling her she has to get out on Friday, right? And she's like, What do I do?" So she's looking for assisted living facility because she doesn't know what to do. I don't think that was the best way to convey that message to a daughter about her mom, but come to find out, her Medicaid lapsed. And so because of the COVID and the governor's cutback on the Medicaid spending dollars, she said she had no clue. And it was expired since February. So now she has to go through the whole rigmarole with Social Security and access to try to get her mom back on. But she had a dual Medicare with United with the Medicare and Medicaid. So now, since her Medicaid lapsed, her Medicare is now going to be termed at the end of the month. Hence why the facility told her it's time for her mom to leave. So I think part of the solution is bigger than us, and it's something that, as caregivers, we have to lobby at Tallahassee to say, one, how do you cut someone's insurance off, right? And not notify. I mean, every means, a phone call, a letters, whatever that looks like. And that's just one case. And I deal with this, not unfortunately, but I'm also an honorary case manager is what I call it, because these are the type of situations that I have to deal with the families, right? But that has happened across the board all year this year, and I don't know if other families have dealt with it, but I think one of the problems that we need a solution to is our healthcare system and how Medicare, Medicaid is going to help bridge this initiative that, because people need support, they need help. And how do you do that, you know?
If I may,
Please.
I agree completely. And we heard you say how hard navigating the healthcare system was in your family. And we hear that kind of across the board, right? It is so complicated. Insurance is so complicated. And we've been hearing that for years. And just in the past year or so here in Florida, we have the Florida Alzheimer's Center for Excellence and the federal guide model through the Centers for Medicare and Medicaid, which are helping families navigate the health system and accessing support services and walking that path because it is quite complicated. The Alzheimer's Association has partnered with Ripple to offer those services to people who qualify through their Medicare plan. So again, that's something we'd love to try to help caregivers get connected to because it is a lot more complicated than it should be.
Anyone else like to share thoughts on what we can do to do a better job of supporting caregivers here in Central Florida?
I believe in Central Florida, they need to plug in with our local Orange County government. I can speak in both aspects, with children and also elderly because I have my father. But as for the children, I was at a point where I was in survival mode, depleted my savings and everything. And I'm like, okay, what am I going to do? How am I going to get this? And I think with the background that I have with a certified nonprofit professional, I just started researching if they had a manual for at least for the nonprofits, the local nonprofits or state nonprofit, nationwide nonprofits that are workable, referral for a bedding for a child, Ashley Furniture, any referral just for it to be reliable.
It
That's
sounds
what.
like you had to be curious as a caregiver.
Yes, I did. I had to be, and when I was working with Children's Home Network at the time, they relied on my resources as well, because they're also statewide. As for the seniors, when I redesigned myself because I had to uh, take care of my dad and take care of the kids and me being stressed out, and I'm just like, I don't want to do this medication stuff and everything like that. So then I said, you know what? Let me just take time and help dad, but also to help other seniors with emotional support.
Yeah.
When you provide them emotional support, provide them a resource as well to alleviate that stress that they're going through. Oh, I don't have enough money for my light bill. Light heap, Orange County Light heap. Oh, I need public assistance with food. Give them a list of reliable, worthy, unexpired food distribution, food pantries. Just have that passion. If you're working with the elderly or the children, have that passion. If you don't have the passion to work with them and to care for them, don't. You shouldn't be you should not be in that position
I see why
because
you're
they need us. They need us because there's oh so many hours within a day and the schedules of the children that they after school they have to go to behavior specialist, or if it's my dad, they occupational therapy, physical therapy, all these type of people coming in my house or something like that. Just assist us. So like that, we're able to help our loved ones and also help others.
I see why they call you the resource queen within your family or friends.
It's I had to explore that. Every majority of companies, let's say Toyota, I was like, okay, so Ashley Furniture has this for foster children. So what does Toyota have? And, just Toyota nonprofit or Ashley Furniture nonprofit. Something is going to come out. They didn't have anything for children. They had something else, but we just have to be curious and and just try and figure things out if they're not helping us, case management.
We have talked a lot about caregiving. I would love to know, what about the experience of the person receiving care? I ask that because my father told me he feels embarrassed asking his daughter for help. He's still trying to protect me and us. What do you say to someone who feels like they're a burden because they need help? Lindsay?
I think that's a hard question to answer, but I mean, reminding, like you said, it's such an honor to get to care for your parents. I mean, trying to remind them of that. I mean, let's be real. Caregiving in a way is a burden. I mean, it's having some form of a burden on our life, but that doesn't mean the person is a burden, and trying to remind them of that. But I do think some of that embarrassment is always going to be there in the kind of societal messaging we receive in the US, but reminding them that it's nothing to be embarrassed about. And for example, my grandfather didn't want to take baths, right?
Mhm.
Well, we found out when we brought a male caregiver in, because we were all females in the house, that actually opened up an avenue to get him to take a shower. So trying to kind of finagle ways to take some of the embarrassment out of it too could help.
And there's one more topic I wanted to bring up just based on people here tonight. And we're not going to be able to give it the time it deserves. But what happens when the caregiver who has spent months, years, whatever it is, being a caregiver, having it overtake their life? What happens when the person is no longer there to care for? And Christy, I know you're dealing with this right now.
Yes, I am. My mom passed away about 4 months ago, and I am grieving, and I am working through just not caregiving right now for my parents. And I've had to reach out to get a lot of support from different people. I have been a part of this grief share. They offer this in different churches and communities. And also, they meet like once a month, and you can talk to other people who've had loss. My mom was on hospice. And so there are services that I didn't know about, even though I'm a nurse. I didn't know that hospice offers counseling, grief counseling after your loved one passes away for up to a year. So I've been working with a grief counselor with hospice as well. And they offered it to my siblings, to the grandchildren, to spouses. So I think it's very beneficial. And also, I think just talking to other people that have gone through the same things, it's been beneficial for me because you don't feel alone. And talking to my siblings as well, and just remembering my mom, remembering my dad. And caregiving was not always easy. And I think sometimes people think, oh, you should just think of the good times. And we do, but we also think about some of the challenging times that we've had. And I think as a caregiver, I thought I would feel this sense of relief. And when my mom passed away, but this grief is filling that space. So I don't have the relief that I thought I would have. And so I think it's important to really use resources to navigate the grief after you've lost a loved one and you've been caring for them for so long.
And just to wrap up, I want to go down the line. I'll start with you, Maritza. If you could leave one message for future caregivers or one thing that you'd like to remind people about caregiving, what would it be?
I would say gain a support system. That's really important. Pick and be selective of your support system. That's really important.
I would say to talk about it. I didn't talk about it for a really long time. And then when my dad was moving into his memory care facility, I found the Alzheimer's Association, and they had the walk to end Alzheimer's about 2 weeks after my dad moved in there. And so that really has helped me begin to talk more about it. And I just think that release, we talked about release, I talked about going to therapy, like all of that. Like, I don't care if you think you're annoying, talk about it. Like it's important.
I would say for caregivers that you're not alone, and as difficult as it is, you have to ask for help. Whatever that help looks like for you, you have to ask for help. I'd also kind of say to the wider community that maybe is not caregiving right now, but chances are is going to find themselves there one day. How can you be a support in your community? I would question, do you know your next door neighbor's names? I think we need to return to that sense of community a little bit, because it'd be great if all these resources and government resources and all of that were where we need it to be. And I hope they will be someday. But in the gap we have here, I think we can help those in our community.
Yeah, I agree. I think using the resources that you have. I know sometimes it's hard to find the resources. And I know, I think, if you can find care managers like myself, if you can find different organizations, that can help you navigate through the caregiving. But also, if you don't have those resources, family, friends, and ask for help. And just one big thing that I remember as a caregiver is just to know that you can't control everything. And I think a lot of people are doing the best that they can do. And don't be so hard on yourself. Have grace. Give yourself grace as a caregiver. I agree. Ask for help. You are not alone. And yes, definitely give yourself grace because it is a difficult task. It's not easy. And if you could find support that can help you navigate through it. But that's my biggest thing is definitely ask for help.
That was our latest discussion, Caring Across Generations, part of Central Florida Public Media's Engage in the Community series. And we would like to engage with your community. Are there topics you would like to see addressed that pertain to life and culture in your community? Reach out to us and we may meet up in your neighborhood for a conversation. Send an email to engage@cfpublic.org or send us a talkback on the free Central Florida Public Media app. That's all for this week's edition of Engage. Join us next week when we look at efforts to redraw Florida's congressional districts. I'm Sharon Stone. Thank you for joining us. If you missed any part of our show today, you can always subscribe to the Engage podcast and listen whenever it's convenient for you. All Things Considered is coming up following NPR News.